This is Anderson's Bay Cemetery, and this quiet corner is where many of the Dunedin victims of the 1918 flu pandemic lie. Behind me is a mass unmarked grave for many of those people. Some marked graves for particularly nurses are just around the corner behind me. The 1918 pandemic was arguably the greatest disaster ever to strike New Zealand. In just a couple of months, it killed more than 9,000 people across the country. To put that into contrast, over the 4 years of 1914 and 1918, the First World War, just over 18,000 New Zealanders died fighting overseas. So half as many in just a few months. Ordinary life, as we knew it, ground to a halt. Otago and Southland suffered along with the rest of the country in the 1918 flu pandemic. 223 people died in Otago, 273 in Dunedin, and 500 people in Southland. Invercargill, which had 171 people killed by the disease, suffered particularly severely with one of the highest per capita death rates in New Zealand. Influenza was no respecter of rank. In Dunedin it killed the Roman Catholic Bishop of Dunedin, it killed the Mayor of St Kilda, it killed the daughter of the chairman of the hospital board, it killed the horse trainers, it killed barmaids, it killed wharf workers. It was indiscriminate, it killed anybody.
There's no doubt that the health machine was extremely stressed because of wartime conditions, with key staff either seconded to the military or involved in defence-related activities.
The influenza pandemic brought daily life to almost a complete halt. AMP shows, sports events were cancelled, the trains, the trams were halted, hairdressers, theatres and bars were ordered shut. Churches agreed to cancel services, schools were closed until the new year. The police force and the fire service were virtually non-existent because most people were off sick.